Hello and welcome to Inside Healthcare. Memorial Day 2018 marked only the second time on record that the Twin Cities hit 100 degrees in May, and experts say our recent hot weather could predict that we could expect hot and steamy summer weather. Doctors say knowing the signs and symptoms of heat-related conditions can make the difference between life and death for you and your loved ones. To talk about the top most common summer hazards, we're very pleased to have with us Dr. Christy Trusso, Assistant Medical Director of the Urgency Room. So thank you for being with us. And I apologize I'm messing up your name there. So thank you, Doctor.
Thank you for having me.
You know, I think one of the most common things that we see is dehydration. And I don't know if people take it as serious. What exactly happens with dehydration when it gets hot and humid? And what can people be doing to prevent it and also treat it then if they have it?
Yeah, so dehydration happens in the body when our fluid output exceeds what we can take in. So typically we'd have a normal thirst mechanism where as the body loses fluid, we become thirsty, which prompts us to drink. When we become dehydrated, either we can't keep up because we're losing so much fluid either through sweat or if we're ill, vomiting or diarrhea. But in the summer we worry more about the sweating and the output through that. And our ability to keep up by taking in enough fluids. As we reach dehydration and becoming more and more hot, sometimes we lose our thirst and sometimes we become nauseous or unable to take in those fluids.
So those would be some of those early signs and symptoms?
Well, early signs is usually just really bad thirst and then some fatigue or headache, mild nausea. As you become more severely dehydrated, you can have vomiting, confusion.
So it can be very serious.
It can be very serious.
You know, I think too, like maybe some of the elderly may not be able to feel or experience that dehydration as well, and maybe even the little ones?
Yeah, so people who are very young and very old tend to have a little less reserve. In addition, elderly people don't tend to have the same drive to drink. As we age, we lose some of that thirst mechanism, so we tend to get behind more easily on our fluids.
So when should they seek treatment, and what kind of treatment can they get?
So at the urgency room, we certainly can evaluate for the full spectrum of dehydration. We offer medications for nausea and IV fluids if you've reached the point where you really can't take fluids by mouth anymore. And we can certainly do a full exam to evaluate for your conditions.
That's crazy that you can't take it by mouth at some point then if it gets too bad.
Sometimes you just lose too much and get too far behind.
And any other advice or tips for preventing, treating dehydration?
So just recognizing when you're becoming overheated and hot, taking a break, sitting down in a cool spot, and just making sure you're taking plenty of fluids.
And any particular kind of fluids are better than others? Or?
In most situations, water is fine, but when you reach the point where you're doing really heavy exercise, really heavy prolonged outdoor work, then drinking a sports drink or electrolyte replacement solution would be a good idea.
Sounds great. What about heat exhaustion and heat stroke? What's the difference between them, and what are the symptoms?
So heat-related illness is on a spectrum, so you can see anything from very mild heat cramps and fatigue all the way up to seizures and life-threatening neurologic conditions.
Oh my gosh.
So the heat exhaustion is where you have fatigue, dizziness, maybe some mild nausea and fatigue, but are able to rest, take fluids, and feel better within a couple of hours of getting out of the heat. Mm-hmm. Once you've progressed to heat stroke, that's a medical emergency that you need to seek attention for right away. Anytime you or a loved one becomes confused, excessively sleepy, and certainly for any seizure activity, you should see a medical provider immediately.
And it has to be something, I was thinking, you know, like sometimes when you're out in the sun a long time, you start feeling a little sleepy or tired as well. So what, just more symptoms that you might be looking for in yourself or someone else?
Yeah, so the feeling some mild fatigue where you're able to go in, sit down, rest, maybe have a cool beverage, and then feel better. Those are some signs that your body's getting warm. Mm-hmm. But heat stroke is really when someone is difficult to wake up, confused, saying things that don't make any sense.
It seemed like when we were having those really hot temperatures in May then too, that we were seeing the health officials putting out warnings about the air quality and stuff. What are those concerns as well?
Yeah, as on a hot and humid day, the atmosphere traps the pollutants down near the surface. So those particles are in the air, and as we breathe them in, they can be irritating to the lungs. And this is another thing that is more significant for the very young and the very old, or people with lung disease. So people with asthma or emphysema, COPD, they tend to be particularly affected and sensitive to those conditions.
So to avoid the outdoors if you can. Then.
Right. So know your triggers. Avoid the outdoors if pollutants and allergens are trouble for you.
And at some point, when should they go to the urgency room or seek emergency care?
So certainly any time that you're having shortness of breath and trouble breathing, that's a reason to see a doctor.
What are some of the other things that you were mentioning that you're starting to see already with those early hot days in May that you see in the urgency room? Other related injuries?
Yeah, so as summer comes out, all of us Minnesotans want to get outside and do our favorite activities. So we see a lot of sports-related injuries, anything from broken arms to sprained ankles. We see lots of cuts and scrapes. We do lots of stitches, cuts and scrapes from swimming at the pool. The summer is a great time to get outside and do all those activities, but sometimes you have to visit us if there's an accident.
Well, even just mowing the yard or working in the garden and things like that, I think you can get cuts and scrapes and
Absolutely.
things as well. So some of the other things that you might be seeing, we haven't seen mosquitoes yet, but we know that they're going to be
They're
out
coming.
there. And also tick-borne illnesses, we're seeing a rise of that here, not only in Minnesota but in the upper Midwest as well.
Yeah, so there are a lot of tick-related illnesses out there. The tick-related illness that's most common and most well-known is Lyme disease. It's spread by the deer tick.
And if they see a tick, to remove it or come to the urgency room and you guys can remove it?
Oh, certainly so it's certainly possible to remove the tick at home. If you're unable to, we're happy to help you with that. We recommend that if the tick has been embedded for 24 hours or greater to seek medical attention, because those people would qualify for antibiotics to prevent the spread of Lyme disease.
And talking about diseases too, it seems like in recent years we've heard of some, especially when it's really prolonged hot days, some of the smaller ponds and things like that can breathe some of the waterborne kind of illnesses and things like that.
So diarrhea type illnesses are the most common recreational associated waterborne disease. So main things there are try not to drink the water when you're swimming, which sometimes we do get water in our mouth. Don't go swimming if you have stomach illness or diarrhea. Make sure that children are properly diapered and are taking frequent bathroom breaks.
And that can be a concern as well. I mean, a serious issue if they do get exposed to some of these waterborne diseases.
So there's a variety of infections that can be spread through the water, but diarrheal illness is really the most common. That can be caused by virus or bacteria. The majority of that is a inconvenient but self-limited illness, but there are certainly risks of getting very ill from those illnesses. And again, it's the same populations that are at high risk for the more invasive versions, and those are the young children and the elderly.
And it seemed like, too, I was hearing when we were getting those hot days in May that people were getting too much sun and some were getting some sunburn already, and always a concern making sure that they don't take in too much sun.
Sunburn is a very real risk, particularly early in the season as we again venture out. We certainly want all patients to be protecting themselves from the sun, both to prevent sunburn and then the eventual risk for sun cancers. So applying a good SPF 30 or greater sunblock, wearing protective clothing such as a hat and lightweight lawn sleeve clothes. The peak time of the day to worry about sunburn is really the noon to 4 period. So those are particularly important during that time of the day.
Still plenty of sun early in the morning and late in the day. Other final advice for our viewers on staying safe this summer.
Yeah, I would just say be prepared with all of your safety equipment and proper attire for whatever fun activity you're going to do. Make sure that bike helmets are readily available. If you're going out on a hike or in the woods, make sure you have the appropriate clothing. Lawn sleeves, lawn pants, pull your socks up over your pants to prevent bug bites and ticks.
Well, really great advice, and it was nice to meet you and have you on the show today. So
Oh, thanks so much for having me.
Dr. Tressa. And still ahead, we're going to tell you about a very special free wellness program this summer and how you can be a part of it. So stay tuned.